There's a set of taping techniques that's been designed to address the patellofemoral joint. These were originally designed by Jenny McConnell, a physiotherapist from Australia. The idea behind this taping technique is that the tape is applied over the patella to alter the position of the patella or the activity of the quadriceps muscle. Initially, we need to assess the position of the patella as best as we can. This will give us a good idea of what type of technique we will apply to the patella. The patella should normally track centrally through the trochlea of the femur as we bend the knee and activate the quadriceps muscle. In patellofemoral pain, it's most commonly displaced laterally and also tilted in a few directions. First, we will assess the position of the patella in a medial lateral direction, or a glide. You can use a tape measure or tear a strip of tape, which we can use as marking for the distance between the medial and the lateral aspect of the knee. We will palpate medially for the medial femoral epicondyle. I'm making a small mark there. And the lateral aspect for the lateral femoral epicondyle. I'm then marking the midpoint of the patella. This can be measured using a tape measure, as I mentioned. And then we will measure from the medial femoral epicondyle to the midpoint of the patella. I'm making a mark there. And from the lateral aspect to the midpoint of the patella. If there is a difference in our measurements, in this case, as in most cases, the patella is sitting somewhat laterally displaced. That means our taping will go from lateral to medial. We will also assess this. This was a static measurement. We will look also at a dynamic position. For that, I will place my fingers by the patella on each side of it, medially and laterally, and ask the person to slowly contract the quadriceps muscle. And I palpate how the patella glides in the trochlea and relax. In many cases, in most normal cases, the patella should have a fairly straight glide up towards the anterior superior iliac spine along the axis of the femur. In cases where the medial aspect of the quadriceps muscle is not active, or the passive structure laterally is too restricted, the patella glides more to a lateral aspect. That is a dynamic lateral glide. And contract again, and I palpate the movement of the patella. So I've assessed the patella statically positioned in a medial lateral aspect and dynamically in a medial lateral aspect with contraction of the quadriceps. I now know the patella is sitting somewhat laterally displaced. Then I palpate the underneath surface on the medial border and the lateral border, just like trying to pick up the patella. I'm feeling for how much underneath surface can I palpate medially and laterally. That will give an idea of the orientation of patella in a tilt direction. So a lateral tilt and a medial tilt. If a patella most commonly is laterally tilted, I would feel a lot more under surface of the patella medially and not very much at all on the lateral aspect. That would indicate a lateral patellar tilt. I can assess that dynamically by again feeling the surfaces and passively gliding the patella medially. And during this dynamic movement, if there is a restriction on the lateral aspect, the patella can do a lateral tilting as I glide it. That is positive then for a lateral patellar tilt. I can also assess the patella in an anterior and posterior tilt. An anterior tilt is where the patella is tilted this way, with the inferior patella pole going posteriorly. So for that, I palpate the inferior patella pole and the superior patella border, and I should be able to palpate clearly the inferior patella pole. In a case where the patella is tilted anteriorly, the inferior patella pole will not be palpable or less palpable than the upper border. I can assess this also dynamically by having the person again contract the quadriceps and feel, does then the patella dip down and cause a dip into the fat pad? That's an indication of a dynamic anterior patella tilt. And again, contract. This does not occur in this person. Okay. I've now assessed the patella in a medial lateral glide, medial lateral tilt, and an anterior posterior tilt. I can try to assess also if there's some type of rotational position of the patella. Again, the idea is that the inferior patella pole should be pointing in a line up towards the anterior superior iliac spine with the femur, line of the femur. In a rotated position, the inferior patella pole and the upper border may be oriented in that direction for rotation or in this direction for rotation. And that may have some implications on our taping.